statement regarding the patient with this condition. Okay, take it easy in the cath lab.
Right.
Okay, survival would be better if the PA-SAT was 85% as opposed to 75%. Surgical mortality is comparable to that seen in papillary muscle rupture. General agreement that surgery should be delayed for 1 to 2 weeks following diagnosis about this patient. Okay, let's see what they did.
Okay. Well, the majority who answered it got it right. This obviously is a VSD. You can see the pulmonary artery lighting up here. So where is it coming from? Well, look at, you've got apical akinesis here, and you can see the RV filling here from the apex. The inferior wall is banging away. So this is going to be an apical VSD, which is going to be an LED, like the pathologic slide I showed you a little earlier. So right coronary occlusion is not going to be the right answer. As I mentioned, it doesn't seem to make any difference when you operate on these patients. They uniformly don't do well. So there's no agreement whatsoever about when to intervene on these patients, because nothing seems to have resulted in improved mortality. And papillary muscle rupture it's got the best of, again, if you're going to have a rupture of your myocardium, papillary muscle is the one you want, because these patients, they do well, particularly if you get them earlier. So even if you didn't know the correct answer here, and what does this say? This says a PA-SAT is 85%. What does that tell you about the shunt as opposed to 75%? You got a bigger shunt. As I mentioned, the people with the bigger shunts tend to have better LV function, so their long-term survival usually is dictated by LV function. So 1 would be the correct answer.
So if there's going to be any